Joshua, I'm going to go to baseball. And I just got a glimmer this weekend of maybe there is better news ahead. On the baseball metaphor, are we somewhere out by second base deciding if we can make third base? Or can I be so optimistic on this terrible disaster to say we are rounding third base?
Well, I don't know if I would say we're rounding third base. I would say, though, that it is likely that the worst of the Delta wave in the United States is behind us, although in certain places it's still horrifically bad. And as they're making decisions on who lives and who dies, for example, in Alaska. But the dynamics of the wave are receding in a lot of places, which is great. But we could still see a lot more people sick and dying over the next few months if they're not vaccinated, particularly. So we still have some work to do. I do think, though, that unless the virus mutates again, which could, of course, could happen, we could well be on a pretty steady downward trajectory.
Help us with the summary of your reading. As a voracious reading of your profession, have the political efforts to force vaccination worked? Do you see an observable trend that politics saying get vaccinated works?
Well, I think vaccine mandates get a lot of people vaccinated. And you see that whether they're airline pilots, hospital workers, now teachers in New York. And that's because there are a lot of people who, unless they really need to, they're not going to go out and do it. It doesn't mean they're dug in against it. And I see them when I go out and volunteer as a vaccinator. People show up and I go like, well, why are you here today? And they go, my job required it. I figured I might as well do it. It's not a small number of people. And those are all the people who are going out and getting vaccinated. That's good. Now, of course, there's some people who, are dug in, might even quit their jobs. And that's, terrible all around. Like, we want them to get vaccinated. We want them to have a job. And you've got to worry about certain industries where people, are already, you have a marginal employee base. I've talked to some experts of the nursing home industry who are very worried what could happen when those mandates go into effect, because people could just go get a job somewhere in a different industry. So I think that, in general, it's been pretty helpful. But I don't know exactly how it's going to play out everywhere.
Dr. Sharfstein, let's say someone got a booster shot, let the appropriate time pass. Do they still have to wear a mask?
For right now, it kind of depends on where you are. I think that if there are a lot of cases, remember that even under the best of circumstances, you can still get COVID. It's possible. And so you want to, reduce your chances. So, I think it'd be prudent to wear a mask while there's still a fair amount of community COVID. There's still over 100,000 cases in the United States every day. And that just, particularly when you're like, pressed up in a supermarket line or something, put on a mask. That would be my suggestion.
Or if you're, in a movie theater watching No Time to Die, which I think is what John Farrow was trying to get to earlier.
Thanks, Lisa.
In the morning. So
it was a solid attempt, I thought.
I thought it was really admirable.
It fell flat.
Well, I think that I learned, I looked it up. It's October 8th that the debut is in the United States. Dr. Sharfstein, though, as we do get back to normal, how concerning is this? What is the fear if people are vaccinated and they contract COVID? That they get the sniffles? Honestly, at this point, when do we stop being worried and start treating it just like a common cold if people aren't going to end up getting hospitalized and the risk of death is fairly low?
Well, to me, it's the difference between being extremely worried that I could get very sick, and so I'm like wearing a mask and kind of anxious when I'm going out, versus having been vaccinated, I'm going to put on a mask to reduce the chance that I get sick. There's a lower chance, but some chance of lingering symptoms from COVID. I just rather see it go down in our community. I think we're still having trouble switching from what exactly is going to happen to me to how do I keep my community safe. But if we put that lens on it, then the really important thing is how much is out there. And as there's less out there, then there's less reason for people to worry and wear masks.